Good afternoon, ladies and gentlemen. Welcome to this new segment of Mيدكاست. Today, we are pleased to have the physio Yusuf الصالح, who is specialized in physiotherapy and also specialized in sport medicine and the holder of master in chiropractic. Welcome, Dr. Yusuf.
Thank you for having me. It's good to be here, and thank you for that introduction, Doctor.
It was very brief, actually. I didn't even mention anything, so you deserve more longer
No, because usually
introduction.
people fumble the name,
Yeah.
but you got it perfectly.
Oh,
Yeah.
thank you for listening carefully as
Of
well.
course.
Dr. Yusuf, you are specialized in physiotherapy, and
Yes.
there's a very small difference between physiotherapy and physical medicine as well.
Yes.
And also, we have some surgeons who are specialized in sport medicine, as you are specialized in sport medicine.
Exactly.
So, can you tell us about the difference between these two or three majors we have mentioned?
Well, it's. Thank you for mentioning that I'm specialized in sports medicine. So, physical therapy as a whole
Mhm.
is meant to improve mobility and rehab and functional movement and strengthening.
Mhm.
When we're talking about sports medicine, we're talking about the members of the population that are active or that are professional athletes.
Mhm.
So most of my clients are clients that actually have a healthy lifestyle,
Yeah.
are moving, and most of them are professional athletes.
Mm.
So it does require me as a physical therapist to actually attain that lifestyle of the athlete and tend to go to their training camps and tend to go to travel with them most of the time, especially the national football teams here in Kuwait.
Yeah.
Not just the football team, the volleyball teams.
Mm.
So I think that's one of the major differences, that you're dealing with an athlete
Mhm.
as opposed to dealing with a regular person.
Mm.
Now you should know this, as an athlete, the number one thing that athletes want to do is to go back to their sports as quickly
soon
as
as
possible.
yeah.
As quickly as possible, as soon as possible, and as strong as possible.
Mhm.
I've actually had athletes in the middle of the game, they're bleeding, their heads are like blood is coming out everywhere, and they want to get back into the game.
Mm.
So here it's my job as a physical therapist to tell them, no, you need to calm down, and you need to, your safety's first. And one of the major things that people don't know, that as a physical therapist, if as a sports medicine physical therapist, if I'm in the field with the coach and with the team captain, I'm responsible for the safety of all the athletes there. So if I say the athlete doesn't continue in the game, my
Nobody
word
can.
goes.
Yeah.
When it comes to law, if you're talking about legal punishment or legal moves, this is when we say the physical therapist's word is the final word.
Mhm.
So this is one of the main difference. And if we're talking about the treatment as a whole, the treatment tends to be a little bit more aggressive
Mhm.
with my patients, in terms of, you want to get back as soon as possible, you want to give them the best positive and reinforce feedback, and you want to give them strengthening at the end of the day.
So does that mean that you only deal as a specialized in sport medicine? You only deal with the athletes. You don't deal with the normal people if they have some
I
injuries
do
or
in
some.
certain cases.
Yeah.
I do, because I also in the morning I work in sports medicine sector,
Mhm.
but in the afternoon I have my private clinic. So the private clinic is open to the public, to
Yeah.
everybody, and most of the cases can be related to sports medicine cases.
Mhm.
A lot of them are low back pain. A lot of them are spine related cases or muscle spasms. So you get to be able to treat both cases if they're athletes or non-athletes.
And do you also deal with the patients that goes into surgeries, as example?
Post-surgical.
Yeah,
Post
post-surgical
actually
patients.
we do pre and post-surgical. So based on research, and this is all our profession is all research based.
Yeah.
So based on research, all research have concluded that if you do exercise before the surgery, and if you actually do rehab for that client or for that patient after the surgery, it's going to be more important to do the physical therapy more than the actual surgery itself.
Yeah.
So it's very important to actually give that reassurance and feedback to the patient also.
Especially with the orthopedic surgeries, because they have mentioned before that
Exactly.
if you don't undergo a physical therapy course after the surgery, then it's like there is no benefit from the surgery
Exactly.
itself. So I need you to mention, as you are specialized in physical medicine, how important is physical therapy?
It's probably the backbone of everything when it comes to physical medicine.
Hmm.
Especially if we're talking about an athlete who has an injury, I would say it's 80% of his importance, or his journey of going back to playing again.
Hmm.
Uh, we have to give a shout out to the orthopedic surgeons too, because all of them now, especially in this time, in this day and age, they make sure that the patient goes through physical therapy.
Yes.
If you think about the patient just doing the surgery and then not doing physical therapy after it, there's going to be zero benefit.
Yes.
Absolutely zero benefit.
Yes.
I guarantee you that there will be no benefit for that client after he finishes surgery if he doesn't do any physical
Yeah.
therapy. So the physical therapy starts from day 2. As soon as he's done from the surgery and we say, alhamdulillah, the surgery goes very well, then the physical
He should
therapist takes
start
charge.
immediately.
Yeah, especially if it's a ACL reconstruction. And
Yes.
that surgery is the most surgery done here
It's very
because
common because we have an athletes and we have some players that goes to play like with their friends outside.
So off the top of your head, what's the most common sport that we play here in Kuwait?
Football.
Exactly.
Yeah.
So, and you know, football is a high contact sport. So
Yeah.
there's a lot of there's a lot of
Traumas, let's
accidents.
say,
There's a lot of
accidents.
traumas. There's a lot of clashing together. But that doesn't mean that it's only football. We're also talking about volleyball players here. We're also talking about basketball players and gymnastics
And
and
we have, I think,
martial arts.
yeah, increasing number
martial
of
arts.
martial arts players now.
Talk about my history now. So
Yes.
I used to play martial arts, and so most of the time you'd be surprised that the athletes actually get injured during practice
Yeah.
or during when they're playing with their friends or
Yeah.
during a friendly game. It's actually not during a tournament.
Yeah.
That's more rare. But yeah, so we have to look at the football players here, and that's the most common sport. So we have the most common injuries as ACL reconstruction.
That's a very good brief, but you know, when patient thinks about the treatment, they think about having medication, and I think with the physical therapy, you don't, well, as much as possible, you try to prevent the patient or to avoid using the medication.
Exactly.
So, what are the techniques you usually use with the patients during the physical therapy treatment?
Well, first of all, if there, it depends on the type of injury.
Mhm.
If it's a ACL reconstruction, which is again the most common one, there's a protocol. The ACL protocol, it's worldwide.
Mm.
We actually follow the American Association Football Foundation ACL protocol,
Mhm.
which is stage 1, stage 2, stage 3. And stage 1 is the patient is completely dependent on not non-weight bearing exercise. He doesn't put any weight on his leg, and then we go on to stage 2 and stage 3. The main thing that the therapist needs to do is he needs to use his creativity in exercises and his hands to have the patient walk with his own weight.
Mhm.
So full weight bearing. This is the first bridge that
How
we
long
have
does
to
it
get to.
take?
Well, I would say with athletes, it's different from normal people. With
Yeah.
athletes, within a month, that you would see a really nice difference, and then within 3 months, you would see the biggest difference, and then within 6 months, he's ready to go back to playing his game.
That's for an athlete or for a
That's
normal
for a full-on athlete.
For
Yeah.
the normal one,
For a normal
takes a
person,
bit longer.
it would take 8 months.
8
Not so
months.
much younger. Not so much longer. And surprisingly, most clients actually take 6 months, especially here in Kuwait.
Okay, that's great.
We've got some pretty strong people.
Again, with the physical medicine, people might believe that the physical therapist only uses the hands and in the treatment.
Well, that's more manual therapy at
Yeah.
this time. So the physical therapy, it's a plethora of treatments that we can use. So I can use my hands, and you know, you introduced me also as being a chiropractor, so
Yeah.
I can actually do that as to get the results that I want. We can use modalities for pain management like heat therapy, electrotherapy,
Yeah.
interferential currents, laser therapy, infrared therapy. The list goes on and on. And we can use hydrotherapy like swimming pools. We can use bearing exercise, floor exercises, strengthening exercises, as in going to the gym. It's endless. It's
And
endless at this
do you
point.
consider, you know, some people also believe that the Chinese needles or some sorts of needles can be used in the physical medicine.
100%. I'm a very firm believer in the dry needling. So dry needling is a derivative of Chinese needles. And so if you think about it, all medicine is based on traditional medicine and
Yes.
based on Chinese medicine. So especially physical therapy. And the Chinese medicine, they use a lot of cupping and a lot of dry needling and acupuncture, and they use their hands a lot. So we've derived the dry needling techniques. I'm a very big supporter of dry needling, and any therapists who don't have physical therapists who don't have the dry needling license, they should get it, because
For
you
everyone.
really do see the difference in the therapy. You definitely do see the difference in the patient.
Dr. Yusuf, we are so pleased to have you today, and your speech was very informative
Thank you so
regarding
much.
the physical therapy. Hopefully,
Thank
we
you so
can see
much.
you again here to discuss the updates in the
My
physical
pleasure.
medicine.
Thank you for having me, and thank you for the wonderful questions.
Thank you very much.
Thank you.
Our dear viewers, we have reached to the end of this segment of Mيدكاست. Hopefully, we can see you again with another healthcare specialist. Until that time, goodbye.